Hi everyone, my name is Michelle Vincent and I have recorded my presentation seminar for the latent profiling approach to duration of stalking. First concept we'll be covering is stalking and its definitions. Stalking is a type of criminal harassment described as unwanted, persistent, and repeated behaviors exhibited by one individual towards another. The comparable terms entail of obsessional followers, obsessional harassers, and erotomanics, and have been used by many researchers to describe the same target offender population. Stalking was highly known in the late 1980s when celebrities started experiencing higher rates of unwanted and persistent following. Stalkers most often pursue their victims through frequent and unwanted behaviors, such as telephone calls, watching, sending packages, emails, or letters even. Sadly, findings also suggest that roughly 40 to 50% of reported stalking cases also include more violent and threatening behaviors, such as property damage or physical and sexual abuse. Various definitions of stalking exist based on whether it is exclusively established on the behavioral aspects or if it also incorporates the psychological and social impacts on the victim. Consequently, these differences influence the rate of reported stalking cases, which has been shown to only account for about 50% of stalking occurrences. In hindsight, Malloy and Gothard offered one commonly cited definition, which includes the general key elements of stalking: the willful, malicious, and repeated following and harassing of another person that threatens his or her safety. The important factor here is that the victim must feel unsafe for the police to be involved and take appropriate measures. According to recent findings, the average duration of stalking is approximately 24 months, but can persist anywhere between a few days to a few years. Interestingly, the impacts of duration of stalking in reported stalking cases have been examined in hopes of discovering a relationship with the levels of violent behavior that stalkers impose on their victims. Many researchers propose that persistent stalking will more likely involve greater violent and threatening behaviors towards the victim, as opposed to stalking conduct of a shorter duration. In some cases, the violent behavior may escalate and consequence in serious injuries, psychological consequences, or even death. Nevertheless, little research has recognized a consistent relationship between the duration of stalking and the level of violence amongst all types of victims and stalkers. An interconnectedness between duration of stalking and the nature of the prior victim-stalker relationship has been shown to exist. In fact, persistence of stalking seems to be one of the main factors related to the level of harm inflicted on the victims. Studies have recognized that ex-intimate partners are more likely to become violent compared with casual acquaintances and strangers, who account for only about 5% of violent stalking occurrences. Recent findings have recognized that most persistent stalkers appear to be ex-intimate partners of the victims, whereas strangers stalk for shorter lengths of time. When assessing stalking occurrences with victim-stalker relationships, researchers were able to identify that acquaintance-type relationships account for about 64% of reported stalking cases, whereas ex-partner relationships and strangers account for about 26% and 13%, respectively. Of the victims who have been stalked, over half have been harassed or assaulted by a former partner. And moreover, approximately 81% of victims who were stalked by ex-spouses also have reported to have been physically abused or assaulted by them. Now we move on to the first dimension, the stalker. Based on several studies and findings, most stalkers are male between the ages of 19 and 30, with the average age being 25 years old. They are often unemployed with an above-average intelligence and most likely possess a criminal and/or psychological history. And an important thing to keep in mind is that men usually do not worry about their safety as much as women, thus are less likely to report stalking occurrences. Furthermore, findings support the notion that both male and female perform stalking behaviors. However, they seem to be influenced by different interior motives. Stalkers and behavior models. Stalkers, or obsessional followers, commonly behave in chronic, unpredictable, and unwanted manners. As mentioned before, not one satisfactory definition exists for stalking, therefore various categorizations exist based on behaviors, mental health, and violence of the offender. Additionally, legal definitions differ across countries and states, some clearly stating that behaviors are deemed punishable, and others not considering stalking to be dangerous or harmful whatsoever. There have been multiple issues over the appropriate definition of stalking for decades, and in an attempt to further understand it, various models have been suggested. Now, amongst those models, we have a few examples of 4-factor models as well as 2-factor models. Now, some of the factors that are included within the 4-factor models are those of pursuit, violation, threat, hyperintimacy, approach, surveillance, intimidation, and verbal and physical aggression, and communication, covert pursuit, self-harm, and other kinds of harm. 2-factor models seem to be focusing more on the motives or the behaviors expressed by the individual. The first findings suggest comparing stalking behaviors involving personal contact versus those with no contact. Spitzberg et al. Found that pursuit and aggression were significantly related to the duration of stalking, therefore created a factor structure around it. And lastly, these authors compare reconciliation and reunion to revenge and intimidation as behavioral motivators of stalkers. Another example is a multi-axial classification. Now, Mullen et al. Attempted to describe the different types of stalkers using a multi-axial classification model. In this model, the first axis represents the stalker's motivations, the second axis reflects the victim-stalker relationship, and the third divides psychotic versus non-psychotic persons. With this, they were able to identify 5 stalker subtypes: the rejected, the intimacy seeker, the incompetent, the resentful, and the predatory. Despite the overwhelming controversies on stalking definitions, previous studies have suggested that stalking behaviors could be clustered into 3 main categories, which will be followed throughout the seminar presentation. These consist of violence, surveillance, and contact-seeking dimensions. The violence dimension is one that includes behaviors comprising intrusive, threatening, and/or violent behaviors. For example, death threats, physical harm, verbal abuse, manipulation, and aggression are forms of violent behaviors occasionally expressed by offenders. The surveillance dimension is one that includes behaviors that can be categorized as classic stalking behavior. This type of behavior usually includes following and loitering near locations where the stalker might be seen or that they can run into. Other behaviors included in this dimension would be transferring schools or work locations to try to be near that victim. Lastly, the contact-seeking dimension includes stalking behaviors indicative of attempts to learn more about the target of interest, to get to know them, and possibly develop a relationship. These types of stalkers depend on forming relationships with the victim by starting conversations, sending gifts, repeatedly sending emails or phone calls, and occasionally will become very manipulative in order to achieve what they want, which is a relationship with the victim. Diagnostic assessment of a stalker. According to Mullen et al., some general risk factors currently being considered within clinical assessments of stalkers include that of attachment styles, attitudes towards the victim, state trait anger, level of social competence, presence of deviant social arousal patterns, and poor verbal skills. Attachment styles. Now, findings show that persons with secure attachment styles are less likely to behave violently, as opposed to those who dismiss intimacy. Attitudes towards victims. Here, investigators or law enforcement will identify whether the individual is capable of empathy and if they have resentful or obsessive intentions towards the victim. Here, the officials will look into the victim-stalker relationship to see if there are any patterns. State trait anger. Persons with poor impulse control and lingering feelings of anger will likely behave violently, according to findings. Level of social competence. Now, this concept relates to the person's ability to move on to form new relationships after having rejected or failed the last relationship. And poor verbal skills. Now, here, persons who have been identified to possess poor verbal skills have also been shown to resort to physical violence as a way to express themselves. There has been little to no investigation on the psychopathological makeup of a stalker, or even the psychophysiological consequences the victims may experience. Fortunately, several factors were found to contribute to the stalking behaviors or aggressive violent behavioral patterns. Firstly, findings support that the majority, approximately 85% of stalking offenders, have been diagnosed with a mental disorder. Of those, about 20% of persons suffer from personality disorders alone, and 7% from intellectual disabilities. Interestingly, a comorbid diagnosis is not uncommon among stalkers. For example, many of them experience both Axis 1 and Axis 2 disorders simultaneously. Axis 1 diagnosis. An Axis 1 diagnosis similarly found within stalkers includes schizophrenic disorders, mood disorders, and delusional disorders, as well as substance abuse. Psychosis. Psychotic and non-psychotic individuals are both likely to threaten their victims. However, non-psychotic persons follow through with their threats more oftenly, resorting to abusive patterns. So psychosis has been shown to negatively correlate with the levels of violence. Substance abuse. Substance abuse or substance use disorder is commonly diagnosed amongst obsessional followers. Also, it has been shown to be comorbid with personality disorders, approximately 27% of the time. Moreover, research has shown that violence and substance abuse are positively correlated, meaning, for instance, that alcohol increases the likeliness of stalking and violent behaviors. Axis 2 diagnosis. Those with personality disorders have been shown to express negative correlations with violence. In other words, those with personality disorders seem to exhibit fewer situational threats or violence. However, no significant relationship has been identified between violence and Axis 2 disorders. Erotomania. Many findings suggest that stalkers may suffer from erotomania. Erotomania used to be a term used to describe delusional beliefs experienced by women about a high socioeconomic man of whom she believed was in love with her. Nowadays, psychotic individuals may experience primary erotomania or may be predominantly associated with delusional and personality disorders. For example, diagnosis included in the DSM-4 included that of psychosis with primary erotomania, erotomanic delusions due to the presence of other disorders, such as bipolar disorder, depression, or schizophrenia, and more specifically can be found within the cluster B personality disorder. Criminal history. The criminal history compared with violent behaviors expressed by stalkers has been shown to conclude a positive correlation. Contradictory to that, other researchers find that there are no relationships between criminal history and violence. It has also been identified as a key component for predicting and preventing stalking occurrences, which is why they're still being observed and analyzed. Pathological mourning. Finally, some researchers believe that individuals who have difficulty processing a traumatic loss may not be able to move on and establish new relationships. Consequently, they may develop obsessive stalking behaviors to cope with their unmanageable feelings of rejection and loss. Due to the complexity of stalkers and stalking behaviors, development of effective treatment programs has been difficult. Specific treatment programs must be developed based on the stalker's idiosyncratic psychological profile, the presence of psychosis, the presence of an Axis 1 or Axis 2 disorder, and any other conditions and or personality characteristics that would be relevant. For persons who are erotomanic, the most effective treatment style has included neuroleptics and specific focus on treating behaviors and traits displayed by the person. For rejected, obsessed stalkers or stalkers who suffer from personality disorders, the best treatment includes judicial and psychotherapeutic intervention. In sum, treatment of stalkers is difficult and must target specific psychopathological mechanisms to further benefit the individual. One of the most common issues is the persistence of attendance displayed by stalkers due to a lack of motivation to attend. Now we're moving on to the second dimension, victim. The term victim, or in other words, target and survivor, is used to reference the individual that has been targeted by the stalker and undergoes a series of repeated and unwanted stalking behaviors. It has been supported that women are target victims and are stalked more frequently than men. The typical stalking victim is female, usually the same age of the victim, of whom the stalker has had a prior friendship or romantic relationship with. Although victims' socioeconomic status has shown to vary, the majority of victims seem to be between the ages of 18 and 30 years, highly educated, and or in a high professional career. Social, physiological, and psychological distress displayed in victims. Amongst various social, physiological, and psychological after effects of stalking experienced by victims that have been shown to predominate are heightened distress, diagnosable psychiatric disorders, post-traumatic stress disorders, and sleep disturbances. Additionally, approximately half of the victims who have expressed or experienced. To illustrate, these authors have listed astonishing psychological effects experienced and shared by 100 victims of stalking on self-report questionnaires. These include, but are not limited to, anger and tension, paranoia, fear and nervousness, sadness and depression, distrust and suspicion, and insomnia and sleep disturbances. At some point during the stalking occurrences, 24% of persons in the study admitted having strongly considered and or attempted suicide. Unfortunately, despite the various attempts to show significant and predictive relationship, the prevalence of such relationship is lacking due to the variability of factors involved in both victim and stalker descriptors. In other words, there is no official classification system for victim and stalker typologies, consequences, or treatments. That lack of available and or effective treatment plans usually lead victims to find their own ways of coping with their traumatic experiences. Risk assessment of a victim. Considering the wide range of stalker typologies and motives, the victim's risks are difficult to predict, to prevent, to understand, and to treat. Consequently, risk assessments are made on persons after having experienced stalking circumstances in order for clinicians to take appropriate actions. Most of the risks imposed on victims have been encompassed within three notions. The first one, whether or not the stalker will be persistent and continue to stalk. 2, whether the occurrence will lead to escalated violent behaviors. And 3, whether the violent will suffer psychosocial distress. Psychological distress and lifestyle disruptions among stalking victims have been well documented. Similarly, findings support the negative impact of stalking on the victim's psychophysiological state. Much of the distress experienced by these persons relate to fear of reoccurring and newly introduced violence. In forensic studies, law enforcement, and the scientific community, it is important to determine the risks exposed to the victim in order to appropriately address them and hopefully one day prevent them. Independent coping mechanisms. Studies have found that victims often experience internal changes, professional changes, as well as lifestyle changes as a way to take control and cope with their experienced trauma. These include increased caution, suspiciousness, anxiety, and aggression. Many persons readjust their daily routines, take extra security precautions, and even move or change careers to adopt a fresh start. Unfortunately, it is not uncommon for stalking victims to possess suicidal ideation. However, the rate of attempted suicide is unknown. latent profile approach to the duration of stalking. The purpose of this study was to investigate how the duration of stalking is connected to different aspects within the stalker and victim dimensions. More specifically, with the use of mixture model, referred to as the latent profile analysis, the authors were able to identify victim subgroups and their relations to lengths of experienced stalking occurrences. With the use of statistical criteria, the data analysis provided the researchers with victim classes according to 3 victim stalking relationships: strangers, acquaintances, and ex-intimates, and 3 stalking dimensions: violence, surveillance, and contact seeking. What they decided to do was to use the latent profile analysis, which contains 7 alternate information criteria, to analyze different stalking behavior variables reported by the participants. They were all classified under the 3 dimensions: violence, surveillance, and contact seeking, and the analysis was able to classify 5 of the groups according to stalking behavior variables. Now, according to the results shown in this figure, the obtained value for average latent class posterior probability was very high, which supports that the variables had been appropriately assigned to distinctive victim classes. 5 victim subgroups had been identified and have been labeled based on stalking behaviors unique to their circumstances. Victims assigned to class 1 plot unusually high on surveillance, thus named the surveillance stalking. Victims assigned to class 2 plot below average means, thus labeled low profile stalking. Victims assigned to class 3 plot relatively high on both surveillance and contact seeking and is therefore labeled social lurker stalking. Victims assigned to class 4 plot on average a mean of 0.5 regarding surveillance and contact seeking behaviors. This one is called wide scope stalking. And lastly, victims assigned to class 5 plot an average mean across all dimensions and is classified as baseline stalking. The mean duration of stalking was 296 days, but ranged between 1 and 3,000 days. The results indicate that duration of stalking for periods exceeding 2 weeks is associated with a more violent behavior and increasingly damaging consequences. Now, the other purpose of conducting the study was to investigate the relationship between stalking behaviors and victim stalking relationships, as well as gender, age, stalking dimensions, and victim subgroups. No significant differences were observed when correlating the duration of stalking with gender of reported cases. The stalking duration had a significant negative correlation with the stalker's age. Findings show that 40% of stalkers are 18 years old or younger. And similarly, stalkers between the age of 19 and 30 are responsible for approximately 35% of stalking cases. Stalker dimension, victim subgroup versus the duration of stalking. Now, both the surveillance dimension and contact seeking dimension were shown to be significant predictors of stalking duration. When measuring the stalking occurrences with a duration of stalking of less than 30 days, findings suggest that there are significant group differences. According to these, estranged stalkers commit 55% of stalking cases, with an average duration of 43 days, whereas acquaintances and ex-partners explain 23 and 13% of stalking occurrences, respectively, and stalk for about 330 days. The findings of the study on latent profile analysis concluded that it is in fact possible to distinguish between victim typologies based on the type of exposure to stalking. Latent profile approach was a major contributor for victim subgroup identification in this study. Second, the findings support the notion that victim-stalker relationships are one of the main principles linked to duration of stalking. Finally, the 5 stalking subgroups and prior victim-stalker relationships have been found to both play an important role in understanding stalking durations. Future studies should focus on risk assessment for stalkers and victims to better prevent and analyze different risks and consequences of violence. Similar recommendations have been made by various authors suggesting that prevention strategies should focus on interactions between victim, stalker, and law enforcement, instead of trying to classify them independently. Additionally, it was suggested that law enforcement should get involved early in the investigation rather than waiting to see if the stalker will display violent manners. Thank you for listening.